This initiative is brought to you by the Gauteng Department of Infrastructure Development, celebrating 20 years of freedom and democracy. The Gauteng 10-Pillar Program focuses on achieving the radical transformation of the Gauteng province. In pursuit of government's strategic objective of modernization of the public service, the Department of Infrastructure Development has developed and implemented the eMaintenance system as part of the maintenance turnaround strategy. The eMaintenance system is a web-based computerized maintenance management system that allows medical staff, patients, and members of the public in hospitals and clinics in Gauteng to report defects and breakdowns directly and speedily. The eMaintenance system was first piloted at the Chris Hani Baragwanath Hospital, launched in June 2013. A group of 10 planners consisting of artisans and chief artisans representing all regions and all academic hospitals were assembled to work together with ICT, hospital staff and maintenance managers to create the eMaintenance system. Following a successful and enlightening pilot at the Chris Hani Baragwanath Hospital, the eMaintenance system was rolled out to all health facilities on the 12th of May 2014. Concurrently, the signing of the just-in-time supply agreement for maintenance materials with Builders Warehouse as well as the commissioning of the Maintenance Term Contractors Panel was accomplished. Furthermore, the eMaintenance system utilizes internal capacity as well as artisan skills to respond to defects received through their mobile phones. To date, 52,473 defects have been lodged through the eMaintenance website in the various hospitals and clinics, and of these, the Department of the Infrastructure Development has managed to fix and close a total of 35,420 defects, which translates to 68% of all defects that have been successfully resolved.
eMaintenance means electronic maintenance system. This is like moving from manual to electronic. And if you see a big institution like Chris Hani Bar, where transactions are in hundreds, so it's important for people to get responses on time.
eMaintenance is a way for staff of the Steve Biko Academic Hospital to report all defects in the hospital by logging into your computer and reporting it online.
Right now, through eMaintenance, we have managed to reduce, I would say, complaints or work orders being raised through the client from 150 to an average of 50 now, which means we are doing the right work at the right time.
A defect will be logged by the client, and after a defect has been logged, my role would be to verify the defect. And it's the physical verification that needs to be done, because it may happen while you are doing a verification. In fact, you need to procure material.
It's a quicker way. There's no paperwork. You report it online, and as soon as it's delivered, the people phone you and they ask if they can come and fix it.
eMaintenance is a web-based computerized maintenance management system.
The system has fast-tracked and has improved systems basically, and it has created quick turnaround and prompt response to requests and sorting queries.
Ours is to go through a system, procuring material, and the system will tell you what to do. You verify there's a root cause, and immediately after that, when you view, you realize that you need material, then you buy material. There's a booklet from Builders Warehouse where all material is listed in that, with code numbers. Those that are not in the booklet, you would always use the 6 zeros in buying that material, but you also have to specify the type of material that you need.
It will allow hospital staff, patients, facility managers, and any members of the public to log any maintenance issue on www.emaintenance.gpg.gov.za and via walk-in or calling the reception at their hospitals.
The eMaintenance does meet the needs of the user, because before we didn't have any record of whatever the work that needs to be done in the hospital. But eMaintenance has now made it that whenever a defect has been logged, it never gets lost. The client can still go and check how far is that defect. And everything that has been done with that defect, it is communicated back systematically with the client that has logged that defect until the defect comes to being finished and being closed.
The system is user-friendly in a sense that it is web-based, it is internet-based, which means you can access it from anywhere in the world, which also means you can access it using various devices, your smartphones, and also to use email as a technology to access the system.
It's a one-stop process, and people are able to log in and get reference numbers and reports.
The eMaintenance system, implemented with the just-in-time supply of materials and the panel of term contractors, enables the department to attend and respond within 24 hours for minor breakdowns, 7 days for major breakdowns, and 365 days for major refurbishments.
eMaintenance has now made it that whenever a defect has been logged, it never gets lost. The client can still go and check how far is that defect.
The success of the system can be attributed to the hard work and commitment of a number of employees that gave up everything else to work tirelessly on creating a state-of-the-art maintenance management system. The innovation by the ICT personnel in creating the website and programming complex algorithms that track defects and monitor the performance of each staff member is exceptional. The integration of mobile devices and the creation of a portal to access the just-in-time material stores at Builders Warehouse is a first of its kind in the public sector. The fact that this was all achieved without the utilization of external consultants is an example of what can be achieved through building state capacity, and something that we're all very proud of. The extraordinary progress that these individuals have made to date and the resounding success of the system truly deserves to be recognized and celebrated. The Department of Infrastructure Development is contributing to the improvement of quality of life of Gauteng citizens through the modernization of health infrastructure solutions, and commits to providing high quality and consistent maintenance and project management services to our client departments faster and cheaper than anybody else. The maintenance branch is speeding up the response to the needs of our clients. The training of artisans has been prioritized to ensure specialization in the field of lifts, boilers, and autoclaves maintenance. Site teams have been strengthened through putting movers and shakers in charge of maintenance projects, and we've created self-managed teams to encourage employees to take responsibility and ownership of productive output. We've improved the level of service plans by deploying a skilled workforce with solid training and experience, and providing them with adequate working tools. The maintenance turnaround strategy can be presented concisely as 24-hour response to minor breakdowns, 7-day response to major breakdowns, and 365 days response to major refurbishments.
This system of electronic maintenance has improved the systems drastically, because it has shortened the red tape, and it has improved service delivery basically, and it has put smiles on the face of the users.
This initiative is brought to you by the Gauteng Provincial Government, an activist government for transformation, modernization, and reindustrialization, celebrating 20 years of freedom and democracy.